Okay, I'm going to give you an example of the pay or play concept. Basically, how do you calculate full-time equivalents? We're going to take a hypothetical employer who has 90 employees, 20 of whom are salaried managers. Salaried managers are salaried at 40 hours. They have 70 hourly employees. Their policy is a January 1st renewal, their health insurance policy. They've chosen a 6-month measurement period. And so, as I said before, you start with your implementation date and work back 6 months. So their measurement period is July 1st to December 31st. What do you do? Well, first thing you do is you say, who's a full-time employee? I know they're a full-time employee. I'm not going to be able to argue my way out of that one. And you say, all right, they equal 1 full-time equivalent apiece. The fact that they work 40 hours and not 30 hours is irrelevant. They're not 1 1/3 full-time equivalents. No one can ever be more than 1 full-time equivalent. Then you look at it and you say, who consistently works over 30 hours? So you have hourly employees, but they're full-time employees. They work 40 hours a week. They, somewhere between 30 and 40 hours. You expect them to be there all the time. You don't go through this full-time equivalent calculation for them. You just throw up your hands and say, okay, they're a full-time equivalent as well. That leaves you, well, you also have your seasonal employees that I mentioned earlier that you need to be very careful about. If you have seasonal employees, you pull them out of the calculation, they're 0 full-time equivalents, leaving you with a pool of variable hour employees. Even if you know the variable hour employees aren't going to work 30 hours, it doesn't matter. What we're calculating here are full-time equivalents. If they work 1 hour a week, they're 1/30 of a full-time equivalent. So you add all the hours for all such employees. You can do it in the aggregate, but you really don't want to do that because you're going to need to have the information on a person-by-person basis later. So you have to do it by person or person by person.